Nice to see you, everyone. Thank you for joining. My name is Kevin McAvey. I'm a managing director at AcademyHealth and data nerd. I've been working in the data space for nearly 2 decades now, really working with states, payers, providers across the country to think about how we could best use data to inform our policy program business decisions. Data-based evidence is a powerful tool for helping researchers, community advocates, policymakers, and others uncover health challenges, better target limited resources, and measure progress toward ensuring that every American has the opportunity to live healthy lives. Yet, for too long, many researchers have had limited access to comprehensive and rich data about how our healthcare system is performing, a cornerstone of producing timely and objective research. The Health Data for Action program, HD4A, is a signature Robert Wood Johnson Foundation research program managed by Academy Health and aims to reduce the barriers often faced in accessing rich, comprehensive data by serving as a conduit between data owners and interested researchers. The program launched in 2017 and will wind down in 2026, delivering tremendous and novel research to the field and sharing with every researcher, policymaker, data scientist a replicable model of how existing data assets can be put to use to create actionable insights about our healthcare system. Today, I have the pleasure of speaking with two leaders of the Health Data for Action effort to reflect on the program and the lessons it offers us. We'll be talking with Dr. Kathy Hempstead. Kathy Hempstead is a senior policy officer at the Robert Wood Johnson Foundation. She works on healthcare issues, mostly those related to health insurance costs and access to care. She joined the foundation in 2011, and prior to that, she was director of the Center for Health Statistics, the University, New Jersey Department of Health. Catherine also served on the faculty of Rutgers Center for State Health Policy, where she is still a visitor. She has a PhD in demography and a history from the University of Pennsylvania, and she's brought together all of her research and skills. And I am not getting sponsorship to say this, in a book called Uncovered: The Story of Insurance in America, a book that is on my reading list, and it's from Oxford University Press, just released a few months ago. We're also joined by Megan Collado, a senior director at Academy Health. Megan directs several Robert Wood Johnson Foundation grant rate making programs, including Community Research for Health Equity and Health Data for Action. Prior to joining Academy Health in 2012, she provided research assistance and leadership at the Center for Managing Chronic Disease at the University of Michigan School of Public Health, at the Center for Healthcare Research and Transformation in Ann Arbor, Michigan, the Child Policy Research Center at Cincinnati Children's Hospital, and earlier in her career served as a director of development for a federally qualified health center. Dr. Hempstead, Kathy, and Megan, thank you guys for all that you do, including joining for a bit of a conversation today.
Sure, it's a pleasure. Thanks,
Yeah.
Kevin, for putting this together.
Yeah, thanks, Kevin.
Of course. So I would love to go back in like the way back machine and actually think about what inspired the Health Data for Action program. I'm assuming this is 2016, between 2015 and 2017. Where did the idea come from? And I'd love to hear from both of you about the germ of the idea and then how it grew into this program.
Well, I came to the foundation after running a data center, so I was pretty interested in data. And from the beginning, I think I played with a few different ways of trying to increase data availability as a kind of, function of philanthropy. Like one thing we did was we started this program with, it bounced around in a few different places. It was briefly at Manat, Hicks Compare, which was an attempt to create a public use file of plan level data for the Affordable Care Act, which was starting right when I got to the foundation, and it seemed like there was a huge data void, and everybody wanted to know who was serving what rating area, what were what was the benefit design of different plans, how many plans are being offered, what was off exchange, blah blah blah. And at first the feds weren't that great at having both the healthcare.gov stuff and the state-based marketplace stuff, so there was kind of a data void. And after a few tries, we started working with this company that was then called Veracred, is now called Ideon, and paid them to create this public use file that everybody could use for commercial and non-commercial use, and a lot of people used it, including CBO uses it, and there are a lot of really high quality users of it. And then we negotiated another deal with them that would allow by kind of by request for people to get formulary data and provider network data for certified non-commercial use, and they made that available at no cost too, and we were paying them for that. And then at a certain point, our then lawyer, this is just like a brilliant deal, like gave them a block grant so that those data would be kind of available in perpetuity, which they are. So that was one thing that we did. And then another like really formative thing was that I was approached by this brilliant guy named Josh Gray, who was then at AcademyHealth and is now doing all kinds of other really exciting things. And he came to the foundation and said, we have all this data on doctors' visits. We know all these things about what's happening when people go to the doctor, because we have an EHR, AcademyHealth, and we can tell you if, more people are getting care, or like we can see their source of coverage. We can see if they're getting a prescription filled. And it was incredibly useful. So we used it in some kind of like one-off ways to monitor like sort of the impact of the ACA on coverage and utilization. Mm-hmm. And then, he was really, really sharp and visionary in thinking about like non-commercial applications of these data. And he was going to CDC and saying, this is really useful for looking at flu vaccinations or child obesity and all this stuff. And we did a bunch of kind of one-off things with that data. But I guess, and then a few more things like that. And then finally sort of rolled up to thinking, well, like what's another kind of way, we've done sort of things where we had a particular use, or we did a paper, we did something, and like we were the demand. And then we thought, well, what if we kind of did something a little more free form, and we put this, we pay the data owner to make the data available, and then let researchers. And I was definitely also trying to interest government in the data too, like ARC and CBO and CDC, like let them propose uses of the data for specific projects, and then they could get the data at no cost, and we would pay this small fee to the data owner. So I think, and I wanted to work with AcademyHealth because we had done a lot of things with them. So I went to Megan and asked if she would help like design and run this project. And I think it's so hard to remember, but the first round of it might have really been limited to AcademyHealth. Was it only AcademyHealth
and the Healthcare Cost Institute?
HCCI. Oh yeah, HCCI was an early grantee, so that was sort of an intentional supply of data. It was designed for people to use, for non-commercial use, but they needed to get paid to sort of stay in business. So we sort of added them so that they would be able to make their data available. And of course, that's excellent data, and a lot of people, applied to use it. And maybe we started with just those two sources.
That's right.
It's hard. Anyway, that's how it started. It was kind of trying, having done a few different things with like making like private sector data available for non-commercial use. Then trying something a little bit different where we like sort of became a platform, in a way, a two-sided platform, got these data owners and let people from the research community and from government propose uses.
And I want to follow up on that, and then Megan maybe pick up on the story and like what happened from there with AcademyHealth. But it sounds like you were kind of leading independent investigations, leveraging data, getting some actionable insights, and then thinking about like how could we better connect existing data resources that are out there with folks who could use it. I mean, did you find, if that's accurate, like did you just kind of see the need that people just didn't even know what data was available through public and private sources at present, and this was a good connector, or what was the connection that you were trying to make?
Well, I mean, I felt like the Athena data, I think in particular, was something that I had just developed this relationship with Athena, and I think there were a few like graduate students at Harvard that were using it because they were in Boston, and everything was kind of just informal. And so then it sort of seemed like, wow, well, we could probably leverage this more, get more like high quality uses out of these data if we put it on a shelf. And let people come at it with their best ideas. And so it was just kind of like a next step in like, what are different ways that philanthropy can make data from the private sector available for non-commercial use.
And then enter one of our premier research associations in the country with AcademyHealth.
Yeah. And so Kathy kind of has the inspiration, behind the Health Data for Action program and this goal to really connect researchers with data providers for, as she said, non-commercial, so kind of independent, investigative research analyses. And so AcademyHealth, we are the professional home for health services and policy research, but we also have a long history of managing research grant-making programs for the Robert Wood Johnson Foundation, as well as other funders. And so, and then a deep commitment in our mission to ensuring that research is used to inform changes in policy and practice. And so that sort of, combination of both our experience in grant making, our history of working with Kathy and the Robert Wood Johnson Foundation, and our kind of goal and mission to make sure that research can be used in policy decisions helped to kind of lift up the Health Data for Action program, which, as we've been talking about, really seeks to help address one key barrier that many researchers face in accessing data, which is the cost. So this data, which is really valuable, also is often very expensive, particularly for research purposes. And so the program was really intended to serve as a bridge between researchers and data providers and cover the cost of that data so that researchers could illuminate what is possible in the data to ask and answer questions to address pressing health policy questions and topics.
I mean, it's just astounding when you think about claims and now even EHR clinical data that's available, price transparency data that's available. We were talking about and are going to talk about one of our interviews, the transparency and coverage files and their strengths and weaknesses so far. But like there's a world of untapped and sometimes unrefined data out there. And so going back to 2017, like Megan, do you want to talk a little bit about the journey since then and approximately how many projects were funded, how it's kind of rolled out?
Sure. Yeah. So our first round of funding was offered in 2017. And as we mentioned, we had two participating data providers that round, athenahealth and Healthcare Cost Institute. And we have offered 4 rounds of funding over the full life of the program. And I am proud to say that we have had sort of exponential increase in interest among data providers. And so we started with 2. In our second funding opportunity, we had 4. In our third, we had 8. And we thought, well, we couldn't possibly double it again for our final. And we did exactly. So we had 16.
Really?
We did.
Wow.
Yeah.
That's pretty cool.
We had 16 participating data providers in our final funding opportunity, which is really a huge credit to Kathy and her sort of network and resources and reach in the field and kind of understanding the data providers. And I think it really speaks to, as we were talking about, there are so many different types of data that are important and valuable for research. And so, certainly early data providers were claims data providers and electronic health record providers, but we have also worked with credit data providers. We've worked with clinic data, population health data. We're working with transparency and coverage data. And I do think we've heard from researchers that it was really helpful to see, like, I had no idea there was this kind of data. And that this program was one that both raised the visibility of the data for the researchers, as well as raised the visibility of the research community and the power of that independent analysis and what it can do when researchers can get their sort of hands, skills, and expertise on the available data. And so over the course of the program and the 4 rounds of funding, we had over 800 applications, and we ultimately funded more than 60 projects. So it has just been a huge, and then the data providers varied each round. So there were some repeats, there were new ones each time. And so we probably worked with, more than 20 different data providers across the life of the program. So it has had a huge reach in the data community and the research community. And then, as I'm sure we'll talk about a little bit more, sort of the policy and practice community as we have sought to share the findings from this work.
Yeah, and one of the things that I came to learn along the way was that there was a real unmet need on the part of data owners to have their data used for non-commercial purposes. And what Health Data for Action did for them was sort of a vetting of like potential users, so that they would feel confident, like, okay, this is a legit project.
Yep.
This is going to not make us look bad. This is going to be good. I was so surprised by that side of
That's
the
so
fence, like
interesting.
how many
Yeah.
people came forward and wanted to participate. And they weren't doing it for the money. It was not about the money at all. It was because they feel like we have great data. I'd love someone to look at, and they weren't trying to get people to do like R&D for them or anything.
Yeah.
I mean, they knew it wasn't going to be like that, but I was really pleased by that interest. And all of the participants that I ever identified were really just through word of mouth, and I felt like if I had ever had a more systematic way of identifying data providers, I would have had a lot more.
Yeah. I would love to talk a little bit more next about like where like how you saw the program evolve over time and both like the topics that were covered, how you kind of organize and manage the program, the types of data sources that were used. It certainly sounds like that portfolio of data providers expanded. But like to just Kathy, if it's okay to pick up on a point that
Sure.
was just really interesting that you made is I always think of like data users being kind of hesitant about like which data source to use and being really concerned about the veracity of the data. But you're raising a point that the data suppliers who might not have been accustomed to kind of sharing their data for non-commercial purposes may have also had hesitations in exploring this kind of release of data for these uses.
Yeah, I think it like made it safe for them because
Yeah.
it was sort of curated and
Yeah.
they were able to participate in the review process. Not we had external reviewers for like scientific merit, but just in terms of feasibility and does this make sense, and is our data set the right one for that? So yeah, I think it was really good for them.
Yeah, that's really interesting. I never really thought about that. And Megan, you mentioned like I think through the life for the program like 20 different data providers. Is there like a list or resource of data providers for others who might be watching this who might be interested in kind of figuring out how to get in touch with folks that have data?
Yeah, I think on our website where we have all the projects, you would be able to see the data set we share, like which data providers have participated, roughly what kind of data assets were made available, and maybe even, examples of the kinds of projects that, used the data. So other researchers can get a sense of what's possible.
Yeah. So the evolution over the course of the program, Megan and Kathy, I'd love to hear your thoughts on how the program changed from the start to the end. And then I'd love to even pick on like where you've seen projects that have had particular impact and that you're particularly proud of, or that you might have found just interesting.
One thing I'll say about the evolution is, we were always trying to balance this interest with extending access to the data as broadly as possible with the reality that resources are limited. And so we were always trying to balance the cost of the data with the research grants. And so as the program evolved, we shifted to more of a model where we were providing funding primarily for the data alone without additional financial support for the researchers' time. So it was really looking to provide data to researchers who otherwise had alternative sources of funding or institutional support to conduct the research. And then so as we said, we funded over 60 projects. If we hadn't shifted to that kind of model, we would have funded probably a quarter of that. And so it did really allow us to extend the number of researchers and projects who were able to use the data, but it was at a cost to kind of limiting the research funding that was available for researchers. So we did have some funded awards that were primarily for early career, first-time investigators to support them in pursuing, pilot studies. But that was a shift in the evolution, which I think it had kind of advantages and disadvantages that we continued to grapple with over the life of the program.
Yeah, that's right. I think that I've used this metaphor a lot of times, but like doing a round was kind of like opening up a pop-up store at Christmas time or something. Like you get all these like, data suppliers together, you get them to produce all these descriptions of their stuff. They have a big kind of show and tell webinar thing, whatever. And then you want to fund as many projects as you can because then it's all coming down, So there was definitely a tension between wanting to fund as many projects as possible, which would mean data in-kind support for data only. But that, does advantage certain research teams that, are better resourced. So we did set aside some money for first-time researchers, but there was a lot of interest in, at least for me, to maximize the number of projects. And I definitely started to indulge in this fantasy like midway through that, oh, you know what, we should start like a platform company, and we should just have this going all the time. We should get other foundations would contribute, because it's sort of, there could be so many more projects than there were. Like, we didn't fund a lot of great ones, and we had a very limited window for people to be aware of, it was artificial. It was just artificial around our call. But I mean, like Geisinger Health System, would have probably entertained reasonable requests all year long. They might have had a limit, but I mean, we had to truncate everything based on our finances and based on the timing itself at all. You would need someone to chunk down like $10 million or something to just, let it fund itself. And nobody was that interested in that. But that was one thing that always would, occur to me, is like, you pulling all these things together for a very short period of time, and you're hoping you get these great projects, and then you're taking it all down.
Yeah. Well, if any billionaires are watching this interview,
That's right.
There's a great idea. We can make it happen like that. Do you think that and this is more like a big picture question to take away from here. Do you think that it's really important to reduce the cost barrier to access for like a first engagement, and then after that, when everyone sees the value, they can come back like individually? And I don't know if you have any experience through the program of grantees then kind of going back to the data source afterwards.
I think we probably had researchers who did both. So for some people, it was, so we were lowering the cost for their first use, and for some, we were lowering their cost for a subsequent use. I do think the high cost like continues to be a barrier. And so, yeah, I'm not sure, I think like the first use can be really helpful, but like that cost reality persists even as researchers continue, their body of work.
Yeah, and I feel like a lot of our data providers were fine with the fee. They thought the fee was, they didn't really care about it, or they thought it was fine. So I think they would have continued to make data available at that cost. But I think that maybe if they're trying to sell it internally to their bosses and say, this is a good use of my time, it's probably better to say, hey, I'm working with this foundation. Yeah. They're going to figure out who's the best researcher, and they're giving us some money, versus just like kind of one-offing it on their own when, it could be, maybe end up being a problem for them or not worth it. But I think that I didn't feel like the data suppliers were offering us like discounts.
I'll just add, because I did a lot of the early conversations with data providers, and we would sort of have a conversation to make sure like that they would be able to participate in the program and meet our needs, and that we would be able to meet their needs. And when I would talk with them about the fee, we would just be really upfront about that. And I got the sense from some data providers, they felt like, well, maybe their market rate is higher than that, but they were comfortable with that rate. For others, I think they felt like that was an appropriate rate. But I do think this was just my sense that the visibility that participating in the Health Data for Action program offered them helped to offset any difference in what the actual market cost was.
It brought them to the table. Like
otherwise,
a trusted partner.
Yeah. Otherwise, we wouldn't have had this like exponential increase each time to continue to participate. And I think, they, really commended the Health Data for Action program for the ease of participating in this like review of research proposals. So it was very collaborative between AcademyHealth, the foundation, and the data providers. Thank you. But I think we tried, because it was really integral that they were able to see the proposals and make sure, what was proposed was feasible, that it could be asked and answered with the available data. There were all kinds of different arrangements. So, some researchers just received a, transfer of the data. Others were in a secure enclave. Others were partnered with, data analysts at the data provider. And so it was a very kind of collaborative experience. And I think that we just heard sort of time and again from data providers that the experience of participating in the process was, easy, and they felt like it generated projects that otherwise wouldn't have happened.
Yeah, and that's like one of the many reasons why I just think that the program you guys have developed with Health Data for Action is so admirable and important. It really reduced barriers and helped to balance health pervasive, as I see it, health information inequities that we have in our country and in our healthcare system, where enterprises that might have a wealth of resources can afford to get data. This I think brought in a whole new set of users, and I think that brings us a little bit to talk about impact. Like where did you see like particular areas or collectively the impact of this program had on researchers and the awareness of the data that they might have available to them, or on specific policy areas? I'd love your thoughts and reflections on the program now. What 8 years in retrospect?
Yeah, I have a few examples. One, which will be part of the interview series, is a grantee a few years ago. Dr. Carrie McAdam Marks, who's at the University of Nebraska Medical Center, looked at insulin out-of-pocket costs and what cap on the monthly costs for patients wouldn't prevent them from being able to afford and adhere to their medication. And we connected her with our colleague Josh Kaplan, who you'll also hear from in the interview series, to bring her to the Hill to brief Hill staffers as they were exploring the $35 cap on insulin out-of-pocket costs, which is the cap she recommended through her independent analyses. And that was kind of a really unique example of how she was able to shape her research to be responsive to the different caps that were being considered at the time. And then with the partnership with Academy Health, help prepare her for that briefing and, meet the policy window so that she could inform those discussions as they were happening. And that is our gold standard example. But there are others from the program as well. And I think, as we were talking about that, once you open up this data and can illuminate the insights, you can learn more about the healthcare system, where there may be challenges or gaps. And so another study several years ago led by Rebecca Gurevich and Neil Shaw looked at prenatal care. And typically for pregnant women, the quality of prenatal care is measured by, like, did you go to all of your visits? And as many of you probably know, there are a lot of prenatal visits. And so, the original thinking is that if you go to all your visits, you've gotten the prenatal care that you need, and that's great. But Dr. Gravich and
Right.
Dr. Shaw, check. But Dr. Gurevich and Dr. Shaw, through their analysis of a private payer's data, actually found that more prenatal care wasn't necessarily always better prenatal care, and that it really mattered if in that visit you received the prenatal care that was recommended or that was guideline recommended.
Yeah.
And they found that that didn't always happen, and that patients may have gone to all their prenatal care visits and didn't actually receive all the recommended guideline care. And so they recommended through their study that instead of looking at the count of prenatal care visits, you should be looking at the actual care delivered to determine whether that was high quality. And because this Health Data for Action program partnered them with private payers' data, they were actually able to share their findings with the payer to inform their own assessments of prenatal care quality. And so there are other examples like that of the program where researchers were partnered with hospital systems and were able to identify challenges that patients were experiencing in those healthcare systems that they could then address. So it was kind of a unique, because of that connection between the researcher and the data provider, it was both a project that could be shared broadly, but also inform changes at the host institution as well.
Yeah, tremendously impactful research that came out of it. Kathy, any thoughts on the impact of the program as you've seen it?
Making it available for, academic researchers is only one use case, but we did, and I was really interested in all the different purveyors of that data, and they all have a slightly different view of the elephant, and they're making it available on different terms and, for different purposes. But we got a bunch of them to participate. I think we had 4 different sources of transparency and coverage data in the last round. And that was pretty cool because when proposals came in, they had to kind of look at them together. And you could sort of start to see like which one had data that was better able to address different questions.
So I have a final question here to kind of bring us back to the big picture and also give you an opportunity to share any other closing thoughts about the program as we reflect on the Health Data for Action program over the course of the past 7 or 8 years, which is what lessons should researchers take from this program? What should they be thinking about when they're looking for the appropriate data sources that are out there to answer their research questions?
I hope that the program sort of could let people see that there was maybe a broader range of possibility of potential data sources than they might have known about. We did have lots of kind of plain vanilla data purveyors like the Collado APCD, which is awesome, and great projects came out of that. HCCI, like known sources, but we always had unknown sources, and I think there are tons and tons of people who have access to a very valuable data set and would love to see it used in know that their data has a lot of value, would love to see it used for some kind of non-commercial purpose, and maybe they just have to be asked, and it's not necessarily about the money. I think we made it easier than just a cold call, but hopefully you can see who's willing to make their data available, and I think it could give ideas to researchers for sure. So I think that's hopefully one of the impacts of the program.
Absolutely. And Megan, thoughts, reflections on the program?
Yeah, I think one thing I would say is, we often say we take the 4 action in our name very seriously. And so I would really encourage researchers to think about, because I think with these data, there's a lot of just intellectual curiosity. We heard from many researchers that they just couldn't wait to get their hands on the data, which is great. And then it's great to take that enthusiasm also to make sure that other people can't wait to get their hands on the findings. And so Academy Health, the other, I think, lesson I have is that, we in this program played kind of an important broker role. So we were sort of an intermediary between the foundation and the data providers, between the foundation and the grantees, and then between the grantees and the data providers as well. And in this role offered a lot of technical assistance and training and support for researchers so that they could build their own skills and capacity to share findings with policymakers, with journalists, to give more compelling presentations, to distill this wealth of data into data visualizations. And all of that, I think, is really critical. I think it is no small undertaking to clean, crunch, analyze, and share this data. We've learned that from this program. Mm-hmm. I don't want to understand how challenging it is, but I think the examples of impact we've had also show that there can be huge impact, and kind of focusing on the kind of skills and capacity to make sure that as a researcher, you're ready to share with the audiences who can act on the findings. It really helps to make sure that research can be used for action.
Well, with that well said closing remark, I want to thank you both for taking the time to participate in this interview, for actually setting up the Health Data for Action program. Robert Wood Johnson Foundation and Kathy, you have long been both a champion and a funder of our health data infrastructure to inform public policy questions for the public good. Academy Health has been a tremendous resource for researchers across the country, and both of you together have really been tremendous facilitators of translating data into information to inform policy and program decision making. Thank you all both for all that you've done, and I'm really looking forward to sharing through this interview series some more specifics about that work by interviewing several of our grantees, both on the research side as well as on the data provider side. So thank you both for taking the time.
Thanks, Kevin.
Thanks so much, Kevin.